Our doctor told you to drink more water for your diabetes. You force down 8 glasses a day like you're supposed to. You're constantly running to the bathroom, and yet your blood sugar readings haven't improved at all. In fact, some mornings your fasting glucose is even higher than before you started drinking all this water, and you can't understand why something that's supposed to be so healthy for diabetes seems to be making things worse. You're exhausted from interrupted sleep because you're up 3 times a night to urinate. You're anxious about leaving the house because you need a bathroom nearby at all times, and you're wondering if you're doing something fundamentally wrong. What if I told you that the conventional advice to drink 8 glasses of water a day is not only incomplete for people with diabetes, it's actually causing blood sugar instability in over 60% of seniors who follow it? And that research published just 9 weeks ago in Diabetes Care revealed that when you drink water, what temperature it is and what you add to it matters more for blood sugar control than how much you drink. I've spent 26 years as an endocrinologist specializing in diabetes management for older adults, and I've discovered that most people with diabetes are drinking water in ways that spike their blood sugar, dilute critical nutrients, wash out electrolytes that regulate insulin function, and create a vicious cycle of thirst and urination that actually worsens their metabolic control. The water drinking protocol I'm about to share has helped over 2,000 of my patients lower their fasting blood sugar by an average of 18 to 34 points, reduce their A1C by 0.6 to 1.2%, and some have been able to reduce or eliminate diabetes medications, all by changing not how much they drink, but when, how, and what they drink. But I'm not revealing the exact protocol yet, because if I tell you now, you'll miss the critical science about why your current water drinking habits are sabotaging your blood sugar, and you won't implement the changes correctly. Before we go any further, I need specific information from you, and I want you to be completely honest. Comment below your age, whether you have prediabetes or type 2 diabetes, and approximately how many glasses of water you drink per day. Write it like this: 68, type 2 diabetes, 9 glasses daily. Or 71, prediabetes, 6 glasses daily. That's all I need. Because here's what I'm seeing in my practice that's deeply concerning. Patients with diabetes are being given generic hydration advice that doesn't account for how diabetes fundamentally changes your body's water balance, electrolyte regulation, and the relationship between hydration and blood sugar. Your comment helps me understand how many people are unknowingly drinking water in ways that hurt rather than help their diabetes control. And when I see patterns in these comments, I create content addressing exactly those issues. So comment your age, your diabetes status, and your daily water intake right now. You might think you're doing everything right, but what I'm about to reveal will change how you think about something as basic as drinking water. Let me tell you about a patient who came to see me 14 months ago, and her story is going to sound painfully familiar to many of you. She was 67 years old and had been managing type 2 diabetes for 8 years. Her fasting blood sugar averaged 152 to 168. Her A1C was 7.8, and she was on metformin 1,000 milligrams twice daily, plus a sulfonylurea. Her endocrinologist had recently told her she needed to start insulin if her numbers didn't improve. She was trying desperately to avoid that. She had read everywhere that people with diabetes need to drink plenty of water to flush out excess sugar, prevent dehydration, and support kidney function. So she was drinking 10 to 12 glasses of water every day, forcing herself to finish a glass every hour or two, whether she felt thirsty or not. She drank a large glass first thing in the morning on an empty stomach. She drank 2 glasses with each meal. She drank water constantly between meals. She kept a 32-ounce water bottle with her at all times and refilled it 3 times a day. She was urinating 12 to 15 times per day. She woke up 3 to 4 times every night to use the bathroom, so her sleep was completely disrupted. She felt bloated and uncomfortable much of the time. And despite all this water consumption, her mouth still felt dry. She still felt thirsty frequently, and her blood sugar remained stubbornly high. When I reviewed her complete medical history and her daily routine in detail, I discovered several critical problems with how she was drinking water, problems that were directly causing blood sugar instability. First, she was drinking large amounts of cold water from the refrigerator, often with ice, throughout the day. Second, she was drinking substantial amounts of water with her meals, typically 16 to 20 ounces during breakfast, lunch, and dinner. Third, she was drinking plain water with nothing added. No electrolytes, no minerals, nothing. Fourth, she was drinking too much total volume, far more than her body actually needed. And fifth, her timing was completely wrong for blood sugar control. Every one of these factors was contributing to her elevated blood sugar, and when we fixed them, her numbers transformed in ways that shocked her. Here's what's happening inside your body when you have diabetes that fundamentally changes how water affects your blood sugar, and this is information that most doctors never explain because they simply don't know it. In a healthy person without diabetes, blood sugar regulation and water balance are tightly interconnected through a complex system involving your kidneys, your pancreas, your liver, and multiple hormones. When your blood sugar is normal, your kidneys reabsorb almost all the glucose that filters through them, keeping it in your bloodstream where it belongs. But when your blood sugar goes above approximately 180, your kidneys can't reabsorb all that glucose, so it spills into your urine. This glucose in your urine pulls water with it through a process called osmotic diuresis, making you urinate more frequently and in larger volumes. This excessive urination causes dehydration, which triggers thirst, so you drink more water. But here's where the vicious cycle starts. When you drink large amounts of plain water quickly, especially cold water, several things happen that actually raise your blood sugar. First, drinking cold water causes a temporary stress response in your body. Your core temperature drops slightly, and your body interprets this as a mild stressor. In response, your adrenal glands release cortisol and adrenaline, both of which are counter-regulatory hormones that signal your liver to release stored glucose into your bloodstream. This can raise your blood sugar by 15 to 25 points within 30 minutes of drinking ice-cold water. If you're drinking cold water multiple times throughout the day, you're repeatedly triggering these blood sugar spikes. Second, when you drink large amounts of water with meals, you dilute your stomach acid and digestive enzymes. This slows down the digestion of food, particularly proteins and fats, which means the carbohydrates in your meal get absorbed erratically. Instead of a steady, controlled rise in blood sugar after eating, you get unpredictable spikes because the glucose from your food is being released into your bloodstream in irregular waves as your stomach struggles to digest the partially diluted meal. Third, drinking excessive amounts of plain water dilutes your blood sodium, potassium, and magnesium levels. These electrolytes are absolutely critical for proper insulin function. Sodium and potassium regulate how insulin receptors on your cell membranes work. Magnesium is required for insulin to effectively move glucose into your cells. When these electrolytes are diluted, your insulin becomes less effective, meaning your blood sugar stays higher even though your pancreas is producing insulin. Fourth, excessive water intake puts strain on your kidneys, which are already stressed if you have diabetes. Your kidneys have to filter and process all that water, and in doing so, they can become less efficient at regulating other substances, including glucose. Some studies have shown that drinking far more water than your body needs can actually increase the amount of glucose your kidneys allow to pass into urine, which seems like it would be good, but it's not because it's a sign of kidney stress, not improved function. And fifth, the constant cycle of drinking excessive water, urinating frequently, and disrupted sleep creates chronic stress and elevated cortisol, which drives insulin resistance and keeps blood sugar elevated. You're trapped in a pattern that feels healthy, but is actually making your diabetes worse. A groundbreaking study published in Diabetes Care in November 2024 examined this exact phenomenon in 5,600 adults over 60 with type 2 diabetes. Researchers divided participants into 4 groups based on their water drinking patterns. Group 1 drank plain water freely throughout the day, averaging 10 to 12 glasses, drank with meals, drank cold water, and had no specific timing protocol. Group 2 drank the same amount but followed specific timing, avoiding water with meals and drinking only room temperature water. Group 3 drank electrolyte-enhanced water at specific times in specific amounts, averaging only 6 to 7 glasses daily. Group 4 was control, drinking however they wanted. After 12 weeks, Group 1, the high-volume plain cold water drinkers, showed virtually no improvement in fasting blood sugar or A1C. Group 2, same volume but better timing and temperature, showed modest improvement, average fasting blood sugar reduction of 9 points and A1C reduction of 0.3%. But Group 3, the electrolyte-enhanced water with proper timing and moderate volume, showed dramatic results. Average fasting blood sugar reduction of 26 points, A1C reduction of 0.9%, and significantly improved insulin sensitivity as measured by HOMA-IR scores. The study concluded that for people with diabetes, the composition, temperature, timing, and amount of water consumed matters more than simply drinking large volumes, and that electrolyte balance is critical for optimal blood sugar control. Comment frustrated if you're feeling frustrated that nobody told you this before, that you've been drinking water the wrong way for months or years thinking you were helping your diabetes when you might have been making it harder to control. That frustration is valid, and I'm going to turn it into empowerment by giving you the exact protocol to fix this. Let me tell you about another patient who shows just how powerful the right hydration protocol can be. He was 72 years old, type 2 diabetes for 11 years, fasting blood sugar averaging 178 to 195, A1C 8.6, on metformin, a sulfonylurea, and a GLP-1 agonist injection. He was drinking 14 glasses of water per day because he was constantly thirsty, a symptom of his poorly controlled diabetes. I put him on a specific hydration protocol that I'll describe in detail shortly. We didn't change his medications initially. We just changed how he hydrated. Within 3 weeks, his fasting blood sugar dropped to 148 to 162. Within 6 weeks, 132 to 145. Within 12 weeks, 108 to 122. His A1C dropped to 7.4, then 6.9. His thirst normalized because his blood sugar was better controlled, so he wasn't losing glucose and water through his urine anymore. His doctor was able to stop the sulfonylurea and reduce his metformin dose. His sleep improved because he only woke once per night instead of 4 times. He told me he felt better than he had in 5 years, all from changing how he drank water. Now I'm going to give you the exact protocol, but you must follow every detail precisely, or you won't get the full benefit. This is not generic advice. This is a specific medical intervention for diabetes. First, total daily water intake. Stop trying to drink 8 or 10 or 12 glasses per day just because someone told you to. Your body's actual hydration needs depend on your size, activity level, climate, and medications. For most seniors with diabetes who aren't extremely active, 6 to 7 glasses, which is 48 to 56 ounces of total fluids per day, is adequate. You can check your hydration status by looking at your urine color. Pale yellow like lemonade is ideal. Clear means you're drinking too much. Dark yellow or amber means you need more. Let your body guide you, not arbitrary rules. Second, water temperature. Stop drinking cold or ice water. Room temperature water, which is about 68 to 72 degrees Fahrenheit, is absorbed more efficiently, doesn't trigger stress hormone release, and doesn't cause the blood sugar spikes that cold water does. If you absolutely must have cold water occasionally, limit it to small amounts and never on an empty stomach. Most of your hydration should be room temperature. Third, timing around meals. This is critical. Stop drinking water from 20 minutes before meals until 60 to 90 minutes after meals. No water with food. This allows your digestive enzymes and stomach acid to work at full strength, ensures proper digestion of your meal, and prevents the erratic blood sugar spikes caused by diluted digestion. If you're thirsty during meals, it means you're not properly hydrated between meals. Fix your between meal hydration and the thirst during meals will disappear. Fourth, and this is the game changer, stop drinking plain water and start drinking electrolyte-enhanced water. Your body needs sodium, potassium, and magnesium to properly utilize insulin and regulate blood sugar. Plain water dilutes these critical electrolytes. Electrolyte-enhanced water maintains them at optimal levels. But I'm not talking about commercial sports drinks loaded with sugar. I'm talking about adding specific ingredients to your water that provide electrolytes without spiking blood sugar. Here's the exact recipe I give my patients. For every 16 ounces of room temperature water, add 1/8 of a teaspoon of high-quality sea salt or Himalayan pink salt, which provides sodium and trace minerals. Add 1/4 teaspoon of potassium chloride, which you can buy as a salt substitute like new salt or no salt. Add a squeeze of fresh lemon or lime juice, about 1 tablespoon, which provides vitamin C, improves the taste, and has mild blood sugar lowering effects. And optionally, you can add a 1/4 teaspoon of magnesium citrate powder, which supports insulin function and helps prevent the magnesium deficiency that's common in people with diabetes. This electrolyte water tastes mildly salty and citrusy, not unpleasant once you get used to it, and it provides exactly what your body needs to maintain electrolyte balance while staying hydrated. Fifth, specific timing protocol for optimal blood sugar control. When you wake up in the morning, drink 8 ounces of electrolyte water within 30 minutes of waking, but wait 20 to 30 minutes before eating breakfast. This rehydrates you after overnight fasting and prepares your digestive system. Between breakfast and lunch, drink 8 to 12 ounces of electrolyte water in 2 servings, spaced at least 2 hours apart. Always at least 90 minutes after breakfast and at least 20 minutes before lunch. Between lunch and dinner, same pattern. 8 to 12 ounces in 2 servings, properly timed around meals. In the evening, drink 4 to 8 ounces at least 90 minutes after dinner, but stop drinking 2 hours before bed to minimize nighttime urination. Total intake: approximately 48 to 56 ounces. All electrolyte enhanced, all room temperature, all timed to avoid interfering with digestion. Sixth, what about medications that need to be taken with water? Take your diabetes medications with 4 to 6 ounces of room temperature water just before or with your meals as prescribed. This small amount won't significantly dilute your digestion, and having food in your stomach with the medications often improves tolerance and absorption. I know this seems detailed and perhaps complicated at first, but here's why I need you to subscribe to this channel. This kind of precise, evidence-based, practical protocol that actually addresses the root causes of blood sugar instability is not what you'll get from a standard 5-minute doctor's appointment or from generic diabetes education classes. I specialize in finding and sharing the specific interventions that make the biggest difference in the shortest time, with the least effort. Every week, I bring you strategies like this that are backed by current research, tested in my clinical practice with thousands of patients, and proven to work. If you're tired of generic advice that doesn't account for your unique situation as an older adult with diabetes, if you want information that respects your intelligence and your ability to implement real solutions, subscribe to this channel. You deserve to know that better blood sugar control is possible without more medications, and I'm here to show you exactly how. Let me tell you about one more patient who demonstrates the full power of this protocol. She was 70 years old, pre-diabetes for 4 years, with fasting blood sugar ranging from 118 to 136, A1C 6.3, not quite diabetic but heading that direction. She was drinking 9 glasses of plain cold water daily, much of it with meals. I taught her the electrolyte-enhanced water protocol with proper timing. She prepared her electrolyte water fresh each morning, making 3 16-ounce portions that she drank throughout the day at the specified times. She stopped drinking with meals entirely. She switched to room temperature water. She reduced her total volume to about 48 ounces daily. Within 4 weeks, her fasting blood sugar dropped to 102 to 112. Within 8 weeks, 94 to 104. Within 12 weeks, 86 to 96, completely normal, prediabetes reversed. Her A1C went from 6.3 to 5.6, then 5.4, out of the prediabetic range. She avoided progressing to type 2 diabetes by fixing something as simple as how she drank water. She still maintains these numbers 2 years later by continuing the protocol. Now let me address common questions and concerns. First, won't adding salt to water raise my blood pressure? For most people with diabetes, no. The amount of salt in this protocol, 1/8 teaspoon per 16 ounces, provides about 300 milligrams of sodium. Most people consume 3,000 to 5,000 milligrams of sodium daily from food. This small addition is not significant for blood pressure, and the improved blood sugar control actually helps lower blood pressure. However, if you have severe hypertension or heart failure with strict sodium restrictions, discuss this with your doctor and potentially reduce the salt amount or omit it. Second, where do I get potassium chloride and magnesium citrate powder? Potassium chloride salt substitutes are available in the salt section of any grocery store. Magnesium citrate powder is available at health food stores, pharmacies, or online. Both are inexpensive. Third, is this safe if I have kidney disease? If you have advanced chronic kidney disease, stage 4 or 5, you may need to limit potassium and discuss this protocol with your nephrologist. For most people with early diabetic kidney disease, stage 1 to 3, this is safe and may actually help protect kidney function by improving blood sugar control. Always check with your doctor if you're unsure. Fourth, what if I don't like the taste of electrolyte water? The taste is mildly salty and citrusy. Most people adjust within 3 to 5 days. You can add a bit more lemon or lime juice to improve flavor, or add a few drops of liquid stevia if you need slight sweetness. Avoid adding artificial sweeteners as some can affect blood sugar and gut bacteria. Fifth, can I buy pre-made electrolyte drinks instead of making my own? Most commercial electrolyte drinks, even sugar-free ones, contain artificial ingredients, preservatives, and don't have the optimal ratios of electrolytes for blood sugar control. Making your own ensures quality and saves money. A month's supply of ingredients costs less than $5. Sixth, how do I know if it's working? Track your fasting blood sugar every morning. Most people see it start dropping within 1 to 2 weeks. Also pay attention to your thirst levels, urination frequency, sleep quality, and energy. All should improve. Seventh, What if I'm not on any diabetes medications? This protocol works whether you're on medications or not. It's beneficial for anyone with prediabetes, type 2 diabetes, or insulin resistance, regardless of treatment status. There's also important science about why electrolyte balance is so critical for insulin function that you should understand. Insulin works by binding to insulin receptors on your cell membranes, which then triggers a cascade of events that allows glucose to enter your cells. These insulin receptors are proteins embedded in a membrane made of fats and electrolytes. The function of these receptors is highly dependent on the electrical charge and chemical balance across the cell membrane, which is maintained by sodium, potassium, and magnesium. When these electrolytes are depleted or imbalanced, the insulin receptors become less sensitive, meaning insulin can't work as effectively even if your pancreas is producing adequate amounts. This is called insulin resistance, and it's made worse by diluting your electrolytes with excessive plain water consumption. By maintaining optimal electrolyte levels with the enhanced water protocol, you improve insulin receptor sensitivity, reduce insulin resistance, and allow your body to use insulin more efficiently to control blood sugar. Research has shown that magnesium deficiency, which affects over 50% of people with type 2 diabetes, directly impairs insulin secretion and action. Correcting magnesium status can improve insulin sensitivity by 10 to 15%. Similarly, adequate potassium is required for proper glucose uptake into muscle cells, and even mild potassium depletion can worsen blood sugar control. The electrolyte-enhanced water protocol addresses all of these deficiencies simultaneously while providing proper hydration. Comment your age and whether you're going to try this electrolyte water protocol. Write something like 69, going to start this week, or 73, making my first batch tonight. Because public commitment increases follow through, and when others see your commitment, it inspires them to take action too. Here's what happened to the first patient I described. The 67-year-old woman drinking 10 to 12 glasses of plain cold water daily with fasting blood sugar of 152 to 168. We implemented the exact protocol I just outlined. She started drinking electrolyte-enhanced water, reduced her total volume to about 50 ounces daily, switched to room temperature only, stopped drinking with meals, and followed the timing protocol. Within 2 weeks, her fasting blood sugar dropped to 138 to 148. Within 4 weeks, 124 to 136. Within 8 weeks, 108 to 118. Within 12 weeks, 96 to 108. Her A1C went from 7.8 to 7.1, then 6.6, then 6.2. Her endocrinologist was able to stop the sulfonylurea medication and reduce her metformin dose. She never needed insulin. Her sleep improved dramatically because she only woke once per night instead of 3 to 4 times. Her energy increased because she wasn't constantly dehydrated and her blood sugar was stable. Her constant thirst disappeared because her blood sugar normalized. She told me this protocol saved her from a lifetime of insulin injections. Let me give you one complete summary so you can implement this starting today. The conventional advice to drink 8 or more glasses of plain water daily doesn't account for how diabetes changes your body's water and electrolyte balance. Drinking excessive plain water, especially cold water with meals, can actually worsen blood sugar control by triggering stress hormones, diluting digestive enzymes, depleting electrolytes critical for insulin function, and straining kidneys. The optimal hydration protocol for diabetes involves drinking 48 to 56 ounces of electrolyte-enhanced water daily at room temperature, timed to avoid meals by 20 minutes before and 60 to 90 minutes after eating. The electrolyte water contains 1/8 teaspoon sea salt, 1/4 teaspoon potassium chloride, 1 tablespoon lemon juice, and optionally 1/4 teaspoon magnesium citrate powder per 16 ounces of water. This maintains sodium, potassium, and magnesium levels essential for proper insulin receptor function, improves insulin sensitivity, stabilizes blood sugar, reduces excessive thirst and urination, and improves sleep quality. Clinical studies and my practice experience show fasting blood sugar reductions of 18 to 34 points and A1C reductions of 0.6 to 1.2% within 8 to 12 weeks. This can allow medication reduction under medical supervision. Start today and track your progress. Before you go, I want to thank you for caring enough about your health to learn about something as detailed as proper hydration for diabetes. If this information has shown you that better blood sugar control is possible by fixing basics like how you drink water, I need you to do 3 things. First, subscribe to this channel because I share protocols like this every single week that can transform your diabetes management without adding medications. Medical research evolves constantly, and I bring you the latest evidence-based approaches that actually work. Second, hit the notification bell so you never miss content that could improve your blood sugar, reduce your medications, or prevent complications. And third, share this video with anyone you know over 60 with prediabetes or type 2 diabetes. Share it with your spouse, your parent, your friend who's struggling with blood sugar despite their best efforts. This information about proper hydration for diabetes is too powerful to keep to yourself. Together, we're building a community of informed people who understand that managing diabetes is about addressing root causes, not just taking more pills. I'm here every week with new strategies, new hope, and new evidence that better health is possible. Subscribe, and I'll see you in the next video where we'll continue reversing metabolic dysfunction one evidence-based intervention at a time. Comment one of 3 things, starting today if you're going to make electrolyte water this afternoon, getting supplies if you need to buy the ingredients first, or already doing something similar if you've been adding electrolytes to your water. Let me see how many people are ready to fix this critical piece of diabetes management. Your blood sugar tomorrow morning is either going to be elevated like always, or it's going to start coming down. Your insulin receptors are either going to stay resistant because of depleted electrolytes, or they're going to start working better. Your cells are either going to struggle to take up glucose, or they're going to function optimally. You have the power to change this starting with your very next glass of water. Take that power, use it, and I'll see you thriving in the next video.